Welcome to E3 Rehab. I'm Dr. Mark Sertica, physical therapist. Today, I'm going to share with you how to improve your knee extension range of motion in hopefully the simplest way possible after a knee injury or surgery. Quick disclaimer, make sure that you consult with your physical therapist, medical doctor, or surgeon prior to initiating any new exercises. Before diving into the exercises, I'm going to show you how to perform a self-assessment of your knee extension range of motion. All you have to do is take a picture or video at eye level from the side and draw a line from the side of your hip to your knee to your ankle. If the knee is perfectly straight, that's considered full knee extension. If you can go further than that, that's considered hyperextension, which is normal in most cases and nothing to worry about. When you perform the self-assessment, make sure you're on a flat surface. Don't use your bed or couch. You can either lie on your back or sit upright with hand support. You're going to have your toes facing up toward the ceiling and squeeze your quad muscles while aiming to press the back of your knee into the floor or table. If this is too easy, you can add a prop under your foot like a towel. Prop it up as high as you need, as long as it's comfortable so you can get an accurate measurement. And that's the gist of it. One other thing you can look at though, if you're performing this on a flat surface, is how high up your heel lifts. Let's say you contract your quads on your uninvolved side and note that the heel rises half an inch, but on the involved side, it doesn't move at all. That's an indication that symmetry hasn't been achieved. How much knee extension do you need after surgery? Ideally, the same amount as your uninvolved side. If you can achieve 5 degrees of hyperextension on your uninvolved side, then your goal is to regain 5 degrees of hyperextension on your involved side. You're aiming for symmetry. So if you're going to use the self-assessment, make sure to measure both sides so you have something to compare to. If you've had surgery on both sides or your uninvolved side isn't a good reference due to a prior injury, then I would recommend, at the very least, aiming to get the knee completely straight. There are 2 things that I want to emphasize about the exercises. Do them early and do them often. Do not wait. You need to put rehab at the top of your priority list after a surgery, especially focusing on regaining this knee extension range of motion. The absolute easiest thing that you can do throughout the day, every single day, is active quad contractions. I've never had anyone overdo this. If you're sitting in your office chair and you think of it, scoot forward, straighten your knee, squeeze your quads for 10 seconds, relax, and repeat 10 times. Just finished a meal? Before you get up, straighten your knee, squeeze your quads for 10 seconds, relax, and repeat 10 times. You're watching sports. Every time there's a commercial break or a timeout, squeeze your quads for 10 seconds and repeat 10 times. Super easy. And if you need to intensify it because your range of motion is improving so much, you can use a towel or some other object to aid in creating a calf stretch and straightening the knee as you contract your quads. The other thing that you want to do is prop your heel at least 3 times per day for 10 to 15 minutes. If just propping your heel creates a stretch, that's all you need. If your knee extension is really improving, you might need to put a weight on top. Remember this though, low load, long duration. You do not want to be writhing in pain for that 10 to 15 minutes. You want to create a stretch that might feel a little unnatural or a little uncomfortable, but it's tolerable for that entire 10 to 15 minutes. If you're holding back tears or gritting your teeth, that's too much and it's counterproductive. Those are probably the 2 easiest and most important things that you can start with. As you gain strength and control, you can add a banded TKE, where you have a band behind the back of your knee, anchor to an object, and perform the same quad contractions against resistance. Another great option is retro walking, where you're walking backwards, either on a treadmill or an open space for 10 to 20 minutes. Here are the key takeaways to improve your knee extension range of motion after an injury or surgery. 1. Actively contract your quads with a straight knee for 10 reps of 10 seconds frequently throughout the day. 2. Prop your heel on a towel for 3 sets of 10 to 15 minutes each day. You can contract your quads on and off throughout, Add a weight if needed, but make sure the stretch is tolerable the entire time. And 3, as function slowly improves, add banded TKEs and retro walking, and don't forget to just strengthen the quads in general. Thank you so much for watching. If you liked the video, please smash that like button, subscribe, turn on the notifications, and leave any questions or comments down below. Peace.